So this video is just intended to give you some general navigation pointers, specifically for clinical users in VetView. And this is just meant to allow you to navigate around the system and figure out what's there and that kind of stuff. So we're going to start on the login page. This is what your typical VetView login page will look like. You'll enter your username and password and click the login button. You will land on what we call the home page. There's a widget or a little icon at the top left for getting back to this page if that's where you want to get to. But just one little note on this: you can move these pieces around however you like. So if you want your clock on the top right, you can do that. If you want your open episodes at the far top, you can do that. Far top left. And the system's smart, so it's going to remember where you put everything, and it's going to put it back there the next time you come to the screen. So if you get on the screen and you don't see all these options, there's an add widget option, and if you click that button, you'll see the list of items that you can add to your home screen. If you are a supervising clinician or a clinician that signs off on things like prescriptions and whatnot, there is a widget that we've actually got on ours already. That's My Pending Prescriptions. Very helpful if you have your students putting prescriptions in the system for you, or your techs, and you want to be able to go to one local place and sort of verify or approve all at once. You'll see mine are already approved, but those that are requested, I can hit the little edit button. It'll take me straight to that particular request, and then I can type my username, my password in, to verify that, and I can always get back there by just clicking on the home page. So again, you can add whatever ones you want. A couple things about the widget: prescriptions in process and prescriptions in review status. Those are both pharmacist options, so they're probably not going to be terribly helpful to you if you're a attending clinician. But if you're the pharmacist or pharmacy staff, those can be helpful for you on your home screen. Product estimates. If your hospital is designed in such a way that you are often called upon to give a client an estimate, the product estimate is a nice little widget to have, because you'll see, and you can put it anywhere you want to on your screen, but once you've got it on your screen, it'll allow you to type in a line and sequence number, or if you know the product description, and just sort of run the tally for those. Don't forget about things that you may not add yourself to the bill, like exam fees or those kinds of things. Alright, so general navigation, the icons across the top are going to take you to their respective search screens. So this should be searching for admissions, searching for clients, searching for patients. Accounting is probably something you're not going to be seeing, or is going to be grayed out unless you have permissions to actually do accounting things in the system. So oftentimes it's just the accounting staff that has that ability. So this may be grayed out. If you're a clinical staff, the patient list can be very helpful. And what that list is going to show you is all of your current open episodes. Notice the MyUp open episodes. And if there are deficiencies on those episodes, you will see them off to the right. You'll also see if there are prescriptions that are pending, if there's soaps that need verification. If you got a process in your hospital that actually tracks location, you'll actually see where the patient is as well. The system is only as smart as the people who are using it, so if nobody puts a location in, the system's not going to tell you where the animal is. But if you have people along the way assigned to tracking the location of your animal, that will show in this field here. If you scroll down the screen, there is a second section called Deficient Discharged Episodes. So the difference between the top list and the bottom list is whether or not they're currently in the hospital or in your facility. So if they've been discharged but are still deficient, those are going to be showing right here on your screen. And this is true for any case that you have put your name on. So if I'm a student and I make sure that I assign myself as a student to the case, I'm going to see the same list or I'm going to see the animal in my list. Same as the resident who might be following the case, or the attending clinician, or the faculty member. As long as those individuals are assigned to the case, it's going to show on their list. And that is strictly because you were involved in the case. It's not saying these are what you have to finish. These are the efficiencies that you have to do. But because you are assigned to the case, you need to be able to see what still might be pending for your cases. The idea behind this is if you're the senior clinician, you're responsible for making sure that the record gets complete. but maybe you have your intern or your resident signing off on prescriptions, and you have a student completing the history and the physical. This allows you to see what exactly is still not complete on those episodes. All right, and then on any case, these are my open episodes. Let's just go to something that has a bunch of stuff still pending. So if you click and you'll see anywhere in our system that you see something blue and underlined, that means there's a link to that page. So if I click to it, well, I say anywhere. Anywhere you see blue, it means it's going to change the screen in some manner. It's going to take you somewhere. In this case, if I click on the owner, New Yorker, it's going to take me to the client screen. This is the patient record. There's a short button or short search field up at the top right where you can just type the patient's number in if you know it. And you could also go to the patient search screen and search for the patient. In 90% of the cases, our clinical faculty find it not necessary to use the patient search because they should be able to find all the patients that they were involved with by utilizing their patient list. Unless they're discharged incomplete. And if they're discharged incomplete, then you'd go to the patient search screen and search that way. All right. So this is just some navigation tips on your patient record and general navigation tips for VetView. So VetView is a web-based program, which means that we operate based on the internet browser that you're using. So some rules that dictate how your browser actually functions are browser controlled and not VetView controlled. So I'm in Google Chrome currently on a Mac. And I say that because if I want to, say I'm on a patient search screen. I'm just going to do a generic search. If I've got a search, if I've put criteria in here to search, and all our search fields are dynamic, so if I put an animal name in and the client's last name and do search, it'll find anything that matches either one. But so if I've tiered this search down and I want to be able to come back to this list because maybe I'm not sure if it's another or if it's strands that I'm looking for. If that's the case, if I'm on a Mac, I can hold the command key and click on this. Notice it's blue. Click on this name and it will take me to that patient record. Or in this case, these are not yet assigned case numbers, which means they're pre-admission. So if I hold the command key and click on another, it's going to take me to another's pre-admission screen. If you're on a PC, I believe it's Shift and you click the button. But either way, if I do that, notice I have a new tab that's opening on my screen. And the benefits to that is that, so this is a pre-admission, as I told you, that's why you see this PA, and if I wanted to go directly to the PA, I could click on the PA number. We tried to be really obvious when it's a pre-admission and not an actual episode so that you know why there's no data there. And you can actually click on the pre-admission and see some additional information. But the reason I wanted to show you this is if I wasn't sure and I'm looking at another and this isn't the case that I wanted, I can simply close out of that window and I've still got my search results in the previous tab. So I could open multiples in tabs if I think it's one of these three, and then I can simply navigate between the windows to determine which one is correct. And that's anywhere in VetView. If you're not sure if you want to get off the screen or the search that you're in, you just simply hold the command or the shift key and click on it and it will open it in a new tab. You can also, a lot of times, right click and you have the option to open link in new tab or open link in new window. New tab is going to be an additional tab on your window just like this. New window is actually going to open up a totally new Google Chrome browser window. So, yeah. So general navigation there. Let me find something that's open. No, let's not go that far back. Hold on. Go back to my home page here and just find something that's actually, let me go to my patient list. 9 times out of 10, if you're a clinical staff, you're going to go from your patient list. And I want to go here just because I want to go to something that has a lot of things that are not yet complete. All right, so this is my patient record. The system defaults to show the entire patient record. There are some filters that you can use off to the left. And all I did was click the view all, that opened up the typical window. And now you'll see the default is that we open any open episodes display on the screen because they're open. But you can change that. So if you want to see all deficient episodes or all discharged episodes or all episodes regardless, you have some options there. So that's just going to control how much loads to this window basically. The reason we did not default it to all episodes is because on cases that come to your facility a lot, it's going to take a long time for it to load if there's a lot of data on the screen, and most people don't want that lag. So we defaulted it to the open ones, assuming that the large majority of what you're going to be doing on a regular basis is working on a patient that's in the hospital. All right, you can filter by sort dates, etc. Navigation on the patient screen. 1. At the very top of the screen, you're going to see patient-specific information. If you want to see it expanded, there is an expand option here, and you'll notice if you have patient photos, there is an area for that to display. Anywhere you see an info dot, if you hover over the info dot, additional information will display. And again, if you see a blue underlined section, that will link you to that relevant information. The clinic that displays at the top of a patient screen is the primary clinic for the patient if one has been assigned. This is not relevant to the episode, it's relevant to the patient. So if Dr. Smith at Sue's Animal Clinic is the primary veterinarian that sees this patient and Sue's Veterinary Clinic is the primary clinic that cares for the animal, then that's the clinic information that's going to show here. Where you want to look to find episode-specific information is you want to find the episode header on the patient medical record. And if you click the info dot, that will tell you who referred the patient for this specific visit. Usually they're the same, sometimes they are not. So if anyone who has an ophthalmology service is probably familiar. If you have any ophthalmologists in your area, sometimes the patient gets referred to a local ophthalmologist, and the local ophthalmologist might refer them to your teaching hospital for more specialized care. So the referral for the episode might be the ophthalmologist, the private ophthalmologist that they saw prior to coming to your facility, but the primary clinic that cares for the animal would still be Sue's Vet Clinic. All right, next to the info dot, and you'll notice when I take my cursor off of the episode header, the little icons to the right go away, and that's just because we didn't want to clutter up your space. But if you hover at the header, then you'll see the next little icon over allows you to add a document to your medical record. So this is as if you'd go to the shelf and pull the sheet of paper off. This is where you do that electronically. If you click the add document, you just type in what you're looking for. It will sort it to your unit first and then any of the parent units to that unit. So you'll see I have internal med here, and then above that I have the small animal hospital level documents. But if I wanted to say add a discharge instruction, if I type in discharge and hit enter, then it's going to filter out just my discharge category records. And I'm going to do this default client discharge instructions for internal medicine. If I already have one, I'm going to get a warning, and I'm actually going to cancel because I don't want to add two. But there are some safeguards in place so that you can add additional ones. The system doesn't prevent it, it just warns you if you're going to add a duplicate. And we did that for things like case notes. You may want to add a case note every day, so you don't want to be prevented from adding an additional one every time, every next day. The next one over is your prescriptions, and this is very similar to UVIS. You just type in your information. Once the script is in there like you want it, you do this add script. It will pop a little prescription card up at the top right of the screen. And the one thing I'll say about this is if you're an approver, it may look like your password is saved, but the system will not accept the saved password because we need to know that someone with the appropriate credentials has actually approved this, and we don't want your students coming behind you and just pushing the button because the computer that you logged into saved your password. So you will actually have to type your password in here. If you're the student and you want to send a notice to the approving clinician, you can do the send approval pending notice, and it will send it to the prescribing DVM that you listed here. All right, there is an update weight option here, so if the weight isn't up to date, if you look at this and you know that wasn't the last weight, you can do the update weight, and it allows you to type in a new new weight, excuse me. So that's your prescriptions. The next one over is add requests. And there is a system option in the system that will actually combine the two of these, which is not necessarily advisable, but some schools have decided to do that. But this concept is I'm requesting of another service something to be performed on a patient that I'm attending to. So if I'm internal med and I need an endoscopy and my institution has an endoscopy service, I would request an endoscopy from the endoscopy service using this option here. This is also where you request labs, and you can put multiple requests in for different types of things. So if I wanted to do a small animal CBC, oops, if I can type correctly, I can put that in, and then I can also put like imaging in. Maybe I want to do a diagnostic imaging of the cervical spine, thoracic lumbar. But you see, and the system will farm them out to the appropriate services. When you go to click the next button, so here I'd obviously have to put in my specimen type and the priority. Let's see, I do it now. If I hit next, any request questions that are applicable across the span of requests that you put in will pop in here. If there are duplicates in the system, it should only ask for the question once, and it should farm it out to whatever areas have that question included in the request questions. I'm going to cancel out of that just because I don't want to have to go through and answer all of those while we're on that call. The next tab over is the add problems. So unlike UVIS, we actually add problems to the episode. So if you click the little add problems list, if there were problems on the master problem list, you would see them in the existing problems section. And there would be a little arrow here that would allow you to pull them over quickly into your episode problem list. If you have new problems, you just type them in. Save, and you can change the status of them if you need to initially. Usually that happens later in the visit. And then now that I've added problems, you'll see there's a SOAP section that's now on my record. And then for your SOAPs, your students are just going to go in and they're going to SO, A, and P at whatever level you deem appropriate for your facility. So you can SOAP at the day level or the problem level, or any combination of those. And then there's a rename problem if they need to do that. There's a merge option. There's a mark as inactive, and the mark as inactive, I think that one actually you can still do, but the mark as resolved or mark as deleted, I believe those have to have a permission tied behind them, and certainly approving them would also have a permission. If you click on this little info list, it's actually going to show you who last updated and the date and time that it was last updated. All right. The next one over is your diagnosis. So if you want to add a diagnosis, you click the little diagnosis section, or icon, excuse me, and then you can just type your icon in. You can filter to the receiving unit or not. If you just type in something general, and you click the search button, sorry, you'll see it's now filtered my results to the cardio, anything that involves cardio, and if this is the one I want, if I double click and scroll down, you'll see it. I have now, still not double click. I now have my dilated idiopathic cardiomyopathy on there, and I can decide, is it primary nod, is it definitive or presumptive? Do I need to change any of these? Are they changeable, or do I want to add a morphology? In this case, we said these were not changeable, so you can set that up in your system. And then if I want to add a comment to it, I can as well. The green check mark, anywhere you see that, that's a save icon. And if you are a verifier, you can click the verify button and then simply type your password in. Again, this also requires you to type your password in because we don't want students doing that over your shoulder without your permission. If you have permission to verify other pieces of the medical record, you'll see them just like this, where they're not grayed out. If I didn't have permission to verify them, I would still see them in the list, but they would be grayed out because I don't have access to verify those pieces. right. The next icon over is your TPRs, and if you click that button, then you'll see a TPR now on your record where you can record the TPR information. This next icon over is the discharge patient. Now, one thing to note, you'll see 2 of these if it was an outpatient type of visit. So this particular visit, this patient was checked in as an inpatient because of the type of visit that the appointment was mapped to. So that was intentional. Some people choose to map their appointment types to inpatient types so they don't have to go through the admit process. Other people or other schools have decided not to do that and always require you to push the admit button in order to say, okay, this patient that I brought in to be seen today, I've decided we're going to keep them overnight, and so we admit them into the hospital. The last one, or the one to the far right, is going to be discharge, and that's the thing that you push when you are done with the medical care of the patient. So it's basically your indicator to accounting or whoever that you're done with the medical care for the patient. In your medical opinion, they are ready to go home. And there's your discharge status, discharge date and time, discharging DVM. And you simply click the discharge button to discharge them. The last one over is order management. If you have permission to do that, you can click that and it will take you to the bill where you can one-off add stuff. Now you can add stuff to the bill directly from the patient record. And most clinical staff does that. So if your facility has clinical staff adding stuff to the medical record, adding items to the bill, you can do that directly from the medical record. I'm going to expand this billing section just because I want to orient you to some stuff. Notice there's a deposit section that will show if there have been any deposits taken. There's a total, which will show you the total as of current, what's been added to the bill. Again, the system's only as smart as the people who use it, so if you haven't added the charge, it's not going to compute that. But from here, you'll also see if there's an estimate. You'll see an estimate listed, and it will tell you what the amount of the estimate is if it's saved. If you want to add an estimate, so if you're doing the initial workup, there's a little estimate button here where you can click and add an estimate. And once the owner has decided to use that estimate, there's a save and accept option. The acceptance of the option is what's going to post it here on your billing tab of your patient record. And that's just to give you a good idea of this is the estimate that you gave them, this is where they are, so you'd be able to clearly see my estimate amount was $300, my current total is $295. Maybe I should talk to them a little bit more about what additional care might be needed. And then you also have a link here for PICList. So if you're used to using PICList, you can click here. For the most part, PICList that were in UVA should come into that view if you're migrating data. And then it's just a matter of finding your PICList, it loading, and then you telling it how many of what you did. And you can type in, so if I did 12 of these, and that's probably, I think it's like 3 of these, that's not even, sorry. If I, for whatever reason, had to do 2 fecal floats, I can add that here, and then once you're done adding the charges, you just post it, post them all to the bill at one time from your PICList. Oh, don't double click because Google does funky things when you double click, apparently. Anyways, you would see them pop up here. I'm not sure. I think our system may have just refreshed. You should not see that problem in your system. All right, so that is the nitty-gritty of how you should clinically be able to get to the information that you want. You only have a couple other pieces of information navigationally. The comm log is here off to the right, so it defaults shrunk, but if you need to get to the patient comm log, that's how you do it. To add a new entry, there's a simple new entry button. There's also filter, and the filter is nice because if you just want to find, you talk to someone about, some piece of information, you can type the diagnosis in here and it should pull up anything that had the diagnosis documented. Same thing if you talk to Patricia Dragon and you don't want to see everybody else's, you can filter by who you talk to and it will just pull up your communications with that person. There's a way to print the log, and you need to indicate whether or not you want the internal comments printed. Other things, so visit information is where we're going to do 90% of your work. But if you want to see the master problem list, now keep in mind, this is not the episode problem list. So this is going to be the overall problem list, not your episode specific one. And this system is smart. So if on this episode, I finish the episode and this problem 1 and problem 2 are still active, then they're going to feed automatically to your master problem list. If problem 2 resolved during the visit, then you will see problem 2 marked as resolved on the date that it was resolved, posted here. But it builds as you go, the master problem list does. So it's not like UVIS where you had to put it on the master problem list to be able to soap it on your episode. We work in the opposite direction because we assume on the first visit you're going to document all of the problems the patient's having. And then from that point forward, it's just going to be a matter of adding things that aren't already on the list. And that's why on the visit in the problem list, when you're adding problems, you're going to see. And now you can see it. I have 2 problems on my active problem list. And at the beginning of the visit, I would be able to bring those problems over. See, I've already got them over here. There would be a little arrow here, and all you have to do is bring them over so that you don't have to duplicate things. All right, prescriptions. If you just want to see a list of what's been prescribed, you can view it here at the prescriptions. This is not episode specific. This is patient specific. So if you have 6 things that need to be verified, there is an option here. So you'd have a little box here if they needed to be approved. And then there's the Approve RX option here as well if you have permission to do that. Patient details, if there's something wrong on the breed, color, sex, birth date, any of that information, it can be updated here on the Patient Details tab of the patient screen, provided you have permission to do that. Patient contacts, same thing. You can add new contacts here. You can change or identify who should be receiving medical records. That's what these little icons are for. And if you just hover over them, it'll tell you what the icon means. And then last but not least, there's the patient reminder section. This is just going to list the current reminders. But the nice thing is on your visit, if there are active reminders, you're also going to see them here at the top of the screen. If there were alerts on this patient or for this patient, you would also see them here. And if you need to add an alert, you can actually go to the patient contacts and do, patient details. And if you scroll down, there's a notes section. If you click the notes section and click the add button, you can add an alert. So if this patient had a vaccine reaction and you're the first one seeing it with that reaction, where is my vaccine? There it is. You can add it straight from the patient record just like this. On your patient details in the notes, go to add a note, mark it as an alert, and then specify what happened, you know. After, let me read these. You know, whatever you want to do to alert it. And now you'll see it highlights in red on your notes list, but if I go back to my visit information, you'll also see it at the top here so that you don't miss it. It's also going to show on the pre-admission screen as well as reminders, and I believe it also shows on the client screen as well. All right, and that is pretty much your orientation to this screen. That's 90% of what you're going to do. If you want to check notices that have come to you, there is a mail icon. This does not take you to your email. This is an internal mail system specific only to VetView. And then if you are a clinician, say in endoscopy, and you want to see what requests are coming into your service, there's a request button that you can do that with. And the schedule icon is going to take you to the schedule. And there are ways to set this up that will allow you to identify just your section. So right now I have my default set to podiatry. But I can go up to this tool option, and I can go to change default schedules, and I can find say I'm cardiology. I can bring cardiology over, and I can say that's my defaults. And maybe I want to get rid of some of these. That when you start this, you're only going to have one over there, so you're not going to have to undo anything. You're just going to have to tell the system which schedules you want to look at. But maybe I don't want to see any podiatry at all. Now what's going to happen is it's going to open with cardiology open when I click the schedule button, but I'll also have the option to turn on or off the rest of these as well. And it happens on refresh. So if I refresh the screen, now I see there's my open cardiology and then my options to turn the others on or off. All right, and if you only see one like this, it's just because on the screen that I was setting up my defaults, each column was listed because each column is an individual schedule, but there are resource schedules, so they're tied together by a name. And so that's why I'm seeing fewer options on the left than it looked like I was setting up in that setup screen. All right, that's how you navigate if you are clinical folks. Have fun poking around in the system, and certainly if you have any questions, feel free to reach out to your project manager, and if they have questions still, they are free to reach out to us as well. Thanks so much.